Hello everyone, welcome to Ushirika Elite Hospital podcast. We have conversations concerning healthcare and we trust that you will get more information about your health and wellness. I'm your host, Audi. Today we have our speech therapist who will be with us today. You're welcome.
Hi, I'm Dr. Mumo, a speech and language pathologist at Ushirika Elite Hospital. The role of speech therapy in medicine, it's a medical specialty where we treat and manage communication disorders. Yes.
All right. So just so that we understand, could we please know what are communication disorders in layman's language?
Okay. Let's start by first understanding what is communication. Communication is the ability whereby a person is able to send, receive, process, understand, and express information, ideas, feelings, or thoughts, either verbally or non-verbally, to another person. Because for communication to occur, there must be a second party or a third party. You cannot communicate alone.
Definitely.
So for communication disorders, any health-related condition that may affect your ability to send, to receive, to process, and to express information via either verbally or non-verbally, that's a communication disorder.
All right. And how do you classify communication disorders?
Okay, communication disorders are majorly categorized into two broad categories. That is, there is speech disorders and there is language disorders. If I may start with the speech disorders, we have three categories of, or three subcategories of speech disorders. One is fluency disorders. What is fluency? Fluency is a flow, smooth flow of speech. Anything that disrupts that flow, that's a communication disorder under speech disorders. An example is stuttering or stammering, popularly known as stammering. The other example is cluttering. Cluttering is whereby you find people, there are some people you find that they talk too fast. So that's one category of speech disorders. The other one is voice disorders. Voice disorders, these are conditions that affect your quality of your vocals. There are some several examples of such conditions, but just to name a few, we have aphonia and dysphonia.
All right. Again, Daktari, in layman's language, would you kindly elaborate what aphonia and dysphonia stand for?
Okay. Aphonia simply means lack of voice. Have you ever encountered a patient mwenye amepoteza sauti?
Yes, that used to happen a lot in
Especially those people who they have misused their vocals.
Yeah.
Maybe you have gone for music festivals way back in your secondary school, and then you have shouted or you are cheering a game. The next day you don't have a voice. You like whispering.
Sound like you are whispering.
Yes, that's what we call aphonia. Dysphonia on the other side is hoarseness of the voice. You find that, if I may give an example, and I'm not biased, to these touts in town who call for passengers to board their bus. They shout until unapata sauti yake
It's hoarse.
it is hoarse.
Yeah.
That's what we call dysphonia.
All right.
There are many causes of aphonia and dysphonia, but we shall discuss that in a later.
To look at in the next episodes. All right, on to the other classification.
The third classification under speech disorders, we have articulation disorders. Articulation disorders, an example, this is whereby you find you can get a child who is more than 4 years and still has challenges with pronunciation. An example, a child would like to say, or a child wanted to say like color yellow, but you find that they cannot pronounce it properly. She or he will tell you yayo, or instead of a banana, she will present you some omission of the first sound.
Yeah.
Anana.
All right.
Those are articulation disorders. Yes.
Okay.
The other category, I told you communication disorders are largely
Classified
into two.
Yeah.
Speech disorders and language disorders.
Yeah.
Language means simply the ability of the brain to comprehend. Unaelewa. Because as I told you from the definition, communication is you send, process, you send, receive, process, understand, and express information. So patients with challenges with comprehension, kuelewa, they cannot be able to communicate. So under this category, we have two conditions. We have expressive language disorders and comprehensive language disorders or receptive language disorders. Receptive, from the word reception, to receive. If they cannot comprehend, they will not be able to express themselves. And if they can comprehend and they have challenges with the part of the brain responsible for expression, there will be no communication.
All right.
Yes.
So that closes the two major classifications of communication disorders. And on to our last question. Are there any medical conditions that could cause communication disorders?
Yes. There are very many medical conditions, not necessarily medical condition, even surgical condition that could lead to communication disorders. Just to name a few, we have ASD, autism spectrum disorder, ADHD, attention deficit hyperactivity disorder, cerebral palsy, Down syndrome. We have in adults stroke, depending on which part of the brain has that stroke affected. We have brain infectious diseases like meningitis. We have infections of the brain like meningitis, encephalitis. Drugs and substance abuse may also lead to communication disorders, depending on which part of the brain has the drugs or the drug affected.
All right. Okay.
Lastly, degenerative diseases. For example, dementia in old age, Parkinsonism. Yes.
Okay. I believe we have had a nice conversation and an informative one. Thank you for your time here, Daktari. We are looking forward to have more episodes here where we will discuss each category of the conditions that you handle single-handedly. Okay. Thank you.